I believe that the health of the society, the health of the planet, and the health of business are interrelated. My name is Dr. Allan MacKenzie, and I am a medical doctor by profession. I am an advocate of sustainable development. I am an equity leader, having joined the Equity Leadership Program in the year 2003 after completing my secondary school education at Njiri School, where I emerged as one of the top students in the country. And Equity Building Society then selected me as one of the beneficiaries of the Equity Leadership Program. Together with a couple of other colleagues, about 6 of us. For that year we were about 6 of us. We were selected and we were posted to different branches within the bank. Throughout this time, we got exposed to the different departments within the bank. And I must say that it is during this period where I gathered some of the key things that are driving me even today. For example, we were taught or we were encouraged to be curious, to observe, to learn from experiences, to experiment, to have that entrepreneurial mindset where you can observe an unmet need and look at what capabilities do you have to meet this need. We also got attached to mentors and coaches who would coach us on different things relating to professionalism, work ethic, how the bank operates, the drive and motivation of the bank. We also got exposed to customers of the bank who are driving various initiatives within different sectors, from health to transport to retail business and such. This provided additional insights and helped shape later our professional life. After completing the Equity Leadership Program, I proceeded to join the University of Nairobi, where I pursued a degree in medicine. After that, I joined the Aga Khan University Hospital in Parklands, where I practiced as a medical doctor before proceeding to the University of Cape Town to pursue my master's education. After completing my master's education, I came back to Kenya, where I joined the pharmaceutical industry, where I worked in local, regional, and global roles, driving access to healthcare, especially for people living with chronic or long-term conditions. Some of the things that we learned during the Equity Leadership Program, for example, being able to look at how can I be best to apply my skills and capabilities to address a problem that is facing the society, like access to healthcare. This comes into play here. And looking at some of the other aspects, like the values that we were able to inculcate during that process. For example, of being professional in the way we interact with our clients, being empathetic, being able to listen to what patient or client who is in front of me, being able to listen to what is the problem and how can I be able to be of value and greatest value to this individual. So being able to observe what the gaps are in the provision of healthcare services. For example, there are gaps in providing affordable, quality and accessible healthcare services to the majority of Kenyans. And this is where you observe that there's an opportunity for the private sector to come in and support and complement what is available in the public sector. And this is part of the reason why the Equity Afia model works in Kenya, because it utilizes the capabilities that we have. For example, the huge number of Equity Leadership Program alumni who have gone through the Equity Leadership Program and have done courses in the health sciences are able to get an opportunity to practice their skill and also in the process create a sustainable business model with a real impact on the society by providing quality, affordable healthcare services to Kenyans. Much of my success and achievements that I've achieved so far, I would credit it to partly because of what I gained from the Equity Leadership Program. For example, as I mentioned, we got a lot of coaching and mentorship, and that opened up our minds on the possibilities beyond just seeing patients, that we could actually become part of the broader solution to provide quality, affordable healthcare services to Kenyans. But also, it enabled me to be able to finance my university education. But also, most importantly, the ability for the program to expose us to captains of the industry in the fields that we are in, like in health sector, for example, being exposed to people who are running hospitals, being exposed to people running pharmaceutical, in the pharmaceutical distribution, being exposed to specialists who have gone ahead of us and specialized in different fields. This inspired us, and I would say we had an advantage, or we had an edge beyond what we could gain from the university, for example. So when I was growing up, people used to tell us that the youth are the future. The country belongs to us, tomorrow, in future. But as at now, I feel like there is no tomorrow. It is now, and we need to take up the responsibility to shape how the future will be starting today. And if you look at the opportunities here, the unmet need to solve societal problems is huge. And it is important for the youth, depending on which field they've studied in or which field they are passionate about, to look at how can they be able to provide a solution to a problem that is affecting a large number of people in the society. So it is up to the youth, the young ones, the ones of my age, the ones younger than me, to take up the responsibility, have that curiosity to look at how can I best address this problem, and at the same time maybe create a sustainable business model out of it.